My name is Lakeisha Cotton. Today I'll be doing a physical exam on you. How are you today?
I'm doing great. How about you?
Great. So today I'm just going to be doing head to toe, and you follow my directions and do as I say. What is your name?
LaShara Cotton.
Okay. Do you know where you are?
Yes, I'm currently in Jackson, Mississippi.
Okay. And what is today's day?
Today is November the 12th, 2019.
Okay. Patient is alert and oriented ×3. I'm going to do proper hand sanitation. I wash my hands, so now I'm going to be applying gloves just for my safety as well as the patient's. All right, so we'll first start off with inspection of the face and scalp. So I'm inspecting, looking for any contours, asymmetry, any discolorations. I'm going to be palpating the scalp, searching for any nodules. All right, palpating the face, anything abnormal there. Everything looks good. Okay, so now we'll assess the temporomandibular joint. So would you open your mouth for me? Patient's opening her mouth closed. You can feel that shutting. Okay, so I want you to clench your teeth together. And this is testing cranial nerve 5, trigeminal motor, which is the masseter muscle. So that's great. All right, now I'm going to be testing trigeminal sensory. So we're going to use a cotton swab. Pretend I have a cotton swab. And we're going to go across your face here and tell me, do you feel that?
I do.
Okay, great. Any abnormal sensation there?
No, it just feels really soft.
Okay, great. All right, so now we're going to test cranial nerve 7, facial nerve. So would you smile for me? Raise your eyebrows, frown, puff your cheeks. Okay, great. All right, so cranial nerve 7 looks good. Now we're going to go to the eyes. We're going to move to cranial nerve 2. So I'm going to test using the Snellen chart. Okay, so I'll stand 6 feet away from the patient and ask you to cover one eye, and then read this line for me.
LOPDE.
Okay, next line.
NTFLCZ.
Okay, great. So patient has 20/20 vision. Everything looks good. Do that bilaterally. All right. Now I'm going to assess cranial nerve 3, which is ocular motor. Okay, so I want you to follow my pen. Keep your head still. Up, down, this way. Up, down. All right, you're looking for any nystagmus. Patient does not have any, so everything is normal. I'm going to do the light reflex, test for accommodation and pupillary constriction. Okay, everything looks good there, constricts there. Okay, and then we're going to, great, and I'm looking for accommodation on the opposite side, and it does. And for that horizontal eye movement, that's 3, 4, and 6. Okay? All right. So now I'm going to inspect the pupils. And they are light reactant, rapid, 3 millimeters, and they are equal and regular. All right. I'm also going to inspect the conjunctiva. And they're pink. So everything's good. You notice any paleness with any hypoxia. And then we're going to do the sclera. Great. The cornea, you go at an angle. And the iris looks great. Okay? Moving to the ears. So I'm going to inspect the ears. Looking for any discoloration, any nodules. Everything looks good. I'm going to palpate. And they feel fine. So then I'm going to test hearing with its cranial nerve 8 with the whisper test. Repeat after me.
Cat. Dog.
Okay, great. Awesome. All right, moving right along. We move to the nose. Okay, so I want you to cover one nose and blow. The other nose and blow. Testing for patency. And I'm going to also palpate the sinuses. So do maxillary, frontal, ethmoid. Everything looks good. Okay? So now we're moving to the mouth. Right. So I'm going to use a pen lighter and get you open wide. I'm inspecting the palate, the tongue, the uvula, teeth, gums. Everything looks good. Okay, so I want you to say ah. Okay, next, testing for cranial nerve 9, and then I would do the gag reflex by sticking something all the way to the back, and she would gag, and that would be 10. Okay, I also saw that my patient did not have any tonsils. All right, moving on, we're gonna do upper extremity. So what I want you to do is, let's do cranial nerve 11 first. So I want you to shrug, okay, now shrug without. It's cranial nerve 11, okay, turn your face, great, cranial nerve 11, good. All right, so what I want you to do is, we're gonna do neck. So we're gonna do, palpate the lymph nodes. So we're gonna do submandibular, okay, submental, preauricular, postauricular. You're gonna do occipital, okay. We're gonna do the posterior cervical chain, anterior cervical chain, superficial, and then deep. So deep in there. And then we're gonna do the supraclavicular nodes, okay. It looks great. All right, so we did cranial nerve 11, chin. Can you do your chin to your chest? All right, can you extend all the way back? Great. All right, I'm gonna palpate her trachea. Make sure there's no linear deviation. Everything's bilateral and equal, and I'm gonna palpate her thyroid, making sure there's no enlargement. Okay, so I'm gonna do that next. Okay, so we're gonna do upper extremity. So what I want you to do is raise your arms like this. Good. Okay, put them down. Okay, I would inspect and palpate first, noting for any asymmetry, any muscle loss. Okay, we're gonna do the radial pulse, which is on the thumb side, present. The ulnar pulse, which is on the pinky side, present. And the brachial pulse, which is from the brachial artery. And I would do that bilaterally. Okay, I would do Turger. Okay, so Turger is a sign of hydration, and if it's lagging, then that means she's dehydrated. Okay, I would do the capillary refill. And it's present, and I would do that bilaterally. It should be less than 2 seconds. All right, so now we move to range of motion with the shoulder. So I want you to go over your head, go behind your back. I want you to abduct your arms like we were doing earlier. Okay, we're gonna do that with resistance. Good. Okay, now I want you to bring them down from abduction. Good. Now don't let me bring them down. Good. Okay, we're gonna test the elbow flexion. So flex your elbow. Okay, now I want you to pull. Good. Pull. Good. So I want you to do all this bilaterally. Okay, so now I want you to extend. Great. Now don't let me. Good. Good. Okay. Right. So also I want you to hold your hands like this, and I want you to bring them down. That's pronation, and then I want you to bring them up. Okay, good. All right. Moving right along, let's go to the wrists. Okay, so I want you to extend your wrists like this. Extend, flex. Good. Okay, now I want you to raise. Okay, and I don't come down. Okay, good. All right. Then we move to fingers. So I want you to make a fist. Good. Spread your fingers out like this. Bring them close like this. Okay, we're going to test thumb opposition. So touch each finger. Great, 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 great. Okay. And that's upper extremity. So now we're going to move to cardiac. Okay. So I'm going to inspect first and palpate. So let's touching for any lifts or heaves. Okay. Okay, I'm going to inspect the skin. I don't notice anything. Now I'm going to listen. with the bell and the diaphragm, the bell is for lower frequency sounds and the diaphragm is for higher frequency sounds. So I don't have the bell and diaphragm, so I use the pressure gauge here. This is magnificent. Okay. Also, I'm going to palpate the PMI. Check. Okay. All right. While I'm listening, I'm going to auscultate the carotid artery. Okay. And I want to listen before I touch because I may dislodge something or miss something. And it's palpable there. Okay, good. All right. Let's see where we go next. Okay. Now I'm going to go to the back. Okay. So I'm going to inspect the posterior chest wall. Looking for any discoloration, any asymmetry. Everything looks good. Okay. I'm going to do tactile fremitus. So I place here, and I want you to repeat after me. 99,
99,
99,
99,
99. Okay. I'm going to percuss the long areas. Okay. I'm going to palpate the costovertebral ankle. Note for any tenderness that could be an indicator of kidney infection. Okay. All right. Now I'm going to listen. Okay. Blow. All right. And I'm also going to test for expansion. So breathe in, making sure everything raises equally and normally. All right. Now I'm going to get you to lie down. Moving to the stomach. Okay. All right. So we have the stomach. What I'm going to do is I'm going to listen with the bell and diaphragm to all four quadrants. And you should hear vowel sounds, and I do, which is normal. Okay, I'm going to percuss all four quadrants. Looking for any fluid, listening for any fluid. And then I'm going to palpate lightly first, all four quadrants. And I'm noticing the patient's face. Okay, I'm going to go a little deeper, all four quadrants. And there's nothing there. Okay, I'm going to listen to the renal and aortic and iliac arteries. That's fine. I would also inspect first, looking for any contour. Any discoloration, any scars, any peristalsis. I'm going to inspect the belly button, make sure everything's symmetric and there's no umbilical hernia. Everything looks great. Okay? So now I'm going to sit you, well, before you sit up, I'm going to get you to raise your legs for me. Both at the same time, knees to chest. Okay? Great. Awesome. Okay? I want you to raise against resistance. Okay. All right. So now I'm going to get you to sit up. Okay? And I want you to push. Okay? I want you to push. against me. Pull, pull. Okay. I'm gonna inspect her popliteal arteries. Okay. I'm gonna come down here to her ankle and inspect her tibialis posterior, which is medial, and her pedal pulse bilaterally. I'm inspecting the skin, looking for any edema, anything on the thighs. Everything looks good. Okay. I'm gonna go into reflexes now. Okay. So I'm gonna do the triceps reflex first. Come closer. Come sit. Okay. So I'm gonna hold her elbow out, support, and hit the triceps tendon. Okay. We're gonna do the biceps tendon, support, hit that. Okay. And then we're going to do the brachioradialis. Okay. All right. I'm going to move down to the, scoot back for me, to the patellar tendon reflex. So that should cause a flexion there. I'm going to hit the solar reflex, the Achilles reflex. There you go. All right. So, and I will do that bilaterally. All right. All right, so now patient will bring her heel to her shin. Okay, other leg. Okay, this is testing for cerebellar function. We're gonna do the reflex here, so I want you to touch your nose in my hand. Cerebellar function, that would indicate that something's wrong there. Okay, let's see. We'll do the Babinski reflex. Okay. And her toes should spread and not curl. Okay. Bitch, talk. Fuck it. Sit up.